It appears it will be a longer and anxious wait for the second doses of the AstraZeneca vaccine after the Serum Institute of India said it was doubtful of resuming major exports of the COVID-19 vaccines until October. Anita Nkonge has more.
According to an article by Reuters, the Serum Institute of India may not be able to resume major exports of COVID-19 vaccines until at least October, as it deals with a contagious variant and the pace of administering vaccines in the country has plunged. India's caseload of COVID-19 infections has now surged past 25 million on Tuesday, with a record of over 4,300 fatalities in just 24 hours. However, for a country like Kenya, this news comes as a blow, mainly because its supply is set to run out in just a few weeks. The ministry had hoped to begin to administer the second dose of COVID-19 vaccines through the COVAX initiative by the first week of June.
We are also pursuing other avenues to ensure that this will happen and that the second dose will be received by Kenyans on that day.
Our initial discussions with Johnson & Johnson is that we would start receiving this in August, but once we make commitments, we are able to negotiate to start getting them earlier and try to get almost 2 million vaccines per month. They are easy to administer. It's a single dose.
That was the last update the Health Ministry had on the vaccine rollout plan. It is still not clear what this latest development will mean for Kenya, but across the World Health Organization painted a grim picture of what the world could expect this year when it comes to COVID-19.
COVID-19 has already cost more than 3.3 million lives, and we're on track for the second year of this pandemic to be far more deadly than the first.
In the same breath, the WHO called on wealthy nations to help curb the global pandemic by distributing shares of their vaccines.
I understand why some countries want to vaccinate their children and adolescents, but right now I urge them to reconsider and to instead donate vaccines to COVAX.
Currently, poor countries hold 0.3% of the world's share of COVID-19 vaccines. The US, however, has pledged to donate 80 million doses of some of their Pfizer, Moderna and Johnson & Johnson vaccines. Anita Nkonge, NTV.